y'all, welcome to my channel. I'm really excited to be doing this. I put it out for a long time, but I'm finally doing it. I kind of wrote a script because I'll get on here and start just talking and get off subject. So got a few notes that I took so I can stay on track. I mainly just want to talk about my journey with kidney disease, being on dialysis, and eventually I want to get into talking about my kidney transplant. But for right now, I just want to kind of talk about being diagnosed and everything around that. My main purpose for wanting to talk about my kidney disease and everything with that journey is because when I was actually going through dialysis, I couldn't find a lot of videos with black women who were going through the same thing that I was going through. And I know whenever I'm looking for videos on YouTube, I try to find videos that I can relate to. Well, first of all, what are kidneys? What do your kidneys do? A lot of people don't know that your kidneys are very vital to your body. But your kidney, they are two bean-shaped organs on either side of your spine, below your ribs and behind your belly. Each kidney is about 4 or 5 inches long, roughly the size of a large fist. The kidney's job is to filter your blood. I was diagnosed with end-stage renal failure at the age of 18. End-stage renal failure, also known as kidney disease. End stage just mean I was in the last stage. I had like 17% kidney function. I was barely making urine. I was retaining fluid. Before I was actually diagnosed, I had went to have my first pap smear before I had went off to college. And you know, like when you go to the doctor, they check your blood pressure. My blood pressure was extremely high. I can't remember the exact numbers, but I remember the top number being in the 200s and the bottom number being in the 100s. Now that I'm older and I know how things go, back then she should have immediately done some kind of blood work to figure out why my blood pressure was extremely high, because that's stroke level. Especially being an 18-year-old, my blood pressure had no business being that high. But I remember going to the doctor. My blood pressure was extremely high, and she gave me a pill that she told me was a blood pressure pill and also a fluid pill. So I was taking that pill consistently, and I think about maybe a month had went by. I had already started college, and I remember that I was short of breath. I was starting to retain fluid. Like, I just wasn't right. I was throwing up. I couldn't eat, all of that. So one day I woke up to go to class and I just couldn't do it. So I ended up going to the infirmary on campus. Of course, they gave me a pregnancy test. But yeah, they ended up giving me a pregnancy test and checking my blood pressure. My blood pressure was high there as well. So they sent me to a local doctor. I went to the doctor. He checked my blood pressure. My blood pressure was high there as well. And from there, he sent me to the ER. I was by myself. I was confused. I didn't know what was going on. I didn't have any knowledge of blood pressure. I didn't know how many issues it could actually cause. But I remember going to the ER and them checking my blood pressure, and my blood pressure was high. They checked blood work, and they ended up giving me some medicine, and I ended up calling my mother, and she ended up coming there. And I remember being asleep and waking up and being told that I had kidney disease, which I had no clue what it was. Didn't even know that your kidneys were important, none of that. At the time, I'm thinking your heart and your brain was the main organs of your body. So I wasn't educated at all on kidneys, dialysis, none of that stuff. So they told me that I had end-stage renal failure, which was the last stage. I was in complete kidney failure. I think this was maybe a Tuesday. I had surgery that next day to have a catheter placed. They placed it here, I think, on my left side, and I started dialysis the next day. At the time, it was very overwhelming. I didn't really know I didn't really know how to accept everything. This is my first time ever going through anything. I had never had any surgeries. I had never really been to the doctor for anything more than shit like a cold or anything like that. So all of this was very new to me, especially being 18, thinking I was about to go off to college, start a new life and all that. So I stayed in the hospital for maybe about 2 weeks. It was extremely it was rough. I started dialysis that Thursday, and I had dialysis 3 times a week from then on out. I stayed in the hospital for maybe about 3 weeks, and after that I remember having to go back to my dorm room, pack my dorm room up, and come back home. It was very, 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 very depressing for me. It was a lot to have to deal with being 18. I'm thinking I'm about to start college. I'm about to be partying. I'm about to just, be starting a whole new life, an 18-year-old life, not having to deal with medical issues. I had never dealt with anything like this, so this was all new to me. I think I had been sick for a while, and prior to going and having my pap smear, I remember I had 3 jobs that summer. And I was always tired, and I always had a headache. But I'm thinking I'm tired because I'm working so much and kind of ignoring everything. I was working at a doctor's office at the time, and I remember telling a nurse that worked there that I had a headache. I was complaining of a headache almost every day, and I remember her taking my blood pressure, and it was high as well, just like it was when I had my pap smear. But like I said, I didn't have any knowledge of blood pressure. I didn't know how important it was. And I remember her telling me that I needed to go to the hospital. But me being hard-headed, just kind of ignoring it, I, just kept going on. And the whole time my kidneys was failing, and I didn't even know. But I remember getting home and having to start dialysis at the local dialysis clinic. I remember my first treatment was real rough. While you're there, you're extremely cold. I didn't have a blanket. I didn't have a pillow. I didn't have no snacks. I didn't have nothing. Like, it was just looking back at it, I'm able to not really laugh, but just kind of, it was just a lot to absorb and have to try to get used to at the age of 18. All this happened in 2010. So moving on to the next year. The next year, I think so I started off doing hemodialysis, which is dialysis at the clinic that you do for 3 times a week. My treatment was 3.5 hours. So I did dialysis for 3 days a week, 3.5 hours per treatment. The treatments were extremely rough. It takes a lot out of your body. After dialysis, you're usually extremely exhausted. Sometimes it will drop your blood pressure depending on how much fluid that you have to remove from your body. When I first started dialysis, I didn't really have control of my fluid intake. I didn't take my fluid restriction seriously. I didn't realize that I was supposed to only be drinking. I think at the time, I was only limited to 40 ounces a day, which is not a lot at all. That's maybe 2.5 bottles of water, and that's all I can have for the day until my next treatment. So my treatments at the time were Monday, Wednesday, and Friday. So from Monday and Tuesday, I could only have 80 ounces, which is maybe 7-8 bottles of water over the course of 2 days. Summers were horrible. I would drink, and then when it comes to dialysis, I have 5 or 6 kilos to take off, which is a lot. It's a lot. Like, sometimes I wouldn't even be able to get all of the fluid off of my body in one treatment because it would just be too much taken out of me. It would drain me after dialysis. I didn't want to do nothing but sleep. Like, that's it. With dialysis, you not only had a fluid restriction, there were also different foods that you couldn't eat. You couldn't have a lot of potassium because your body wasn't able to filter out the potassium. You can't have things with a lot of phosphorus. Phosphorus are anything in your foods that has FOS in it. It's basically anything that's processed, anything not fresh, any snack cakes, chips, cookies, none of that I really was supposed to have. I could eat it, but I was extremely limited. It was a lot. Like it was a whole lot that you had to deal with. After dialysis, it just takes everything out of you. All you want to do is maybe get you a Coke for energy and a meal and go to sleep. I would sleep all day, and then the next day would be my off day, and I would sleep all day as well. Dialysis also caused a lot of depression, anxiety, PTSD that I didn't deal with at the time because I guess I didn't realize what was going on. I was just kind of doing it, like just doing it because I knew I had to do it. Like I wasn't really just taking the time to process everything. I didn't do any kind of therapy or anything. And a couple years went by, and I had started to I got knowledgeable about peritoneal dialysis, which is dialysis at home. So with peritoneal dialysis, you have to get a completely different access from what you have, from the access that you use for hemodialysis. You get this port in your stomach. It's about this long, and it goes in your abdomen into your peritoneal cavity. It's kind of rolled up, and about this much is exposed, and you hook up to the machine, and it's kind of like, I'll try to include a picture, but it's like a little, I guess you could compare it to a printer, I guess. It's like a printer that sat on my nightstand at night, and I hook up to that, and it has the cords and stuff that go through the machine, and it filters out your body that way. This type of dialysis is supposed to be healthier for your body because you're doing this dialysis every night. For my prescription was 8 hours a night, every night, and compared to hemodialysis that you do 3 times a week for 3.5 hours. So I did peritoneal dialysis the first time. I did it on 2 separate occasions. I did it the first time for maybe about a year. And I stopped because it was a lot. Like, it was a lot. The supplies that you have would literally like fill a whole entire wall. Like all these boxes. I had to have a 30-day supply. Like literally an 18-wheeler came and dropped off my supplies, and it would fill up like half a room. It was very, 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 it was very stressful. You had to be very, very, clean. Everything had to be sanitized. You had the mask. This is before the world of masks. I think this is like 2012. So you had to wear a mask when you do your treatment. Make sure you wash your hands. Make sure you hand sanitize, because the port is in your stomach, and if you're not careful, you can contract a infection called peritonitis, which is terrible. It's terrible. I had peritonitis before, and baby, it's horrible. It's really horrible. That's I contracted peritonitis the second time that I did peritoneal, and that was the second and final time that I did peritoneal, because I'm just like, this is too much. It was too much to think about. It was like when you're on peritoneal dialysis, you have to look at these supplies every day. You just have to think about dialysis every day, and it's just way more stressful than going to the clinic, letting the nurses do it, and going home and not thinking about it for 2 days. One thing I did like about peritoneal, though, whenever I traveled, I was able to take my stuff with me, but it was also a lot just to do that, because I was young, and if I wanted to go like on a trip with my friends or something, I would be embarrassed to do my treatments because I knew it wasn't normal, and I just felt like an outcast, and so I would skip my treatments, and that caused me to be sick and in the hospital, and it was just a lot. It was a lot to deal with for a young version of myself. So the next year, 2013, I attempted to get on the kidney transplant list for my state. Now, trying to get a kidney transplant, it's a lot. They want you to be almost perfect outside of your kidney disease. They will call the pharmacy to make sure you're picking up your medicines and taking your medicines on time. They doing blood work. They calling your clinic to make sure that you come into all your treatments on time. You're not cutting your treatments short. Like, it's a lot. I think my first round with trying to get on the transplant list, I had got on the list the first time, but I think they had called and did like a checkup after like maybe 6 months, and it was a time where I was depressed, so I stopped really kind of taking my medicine, and they had called my pharmacy to see if I was calling in my prescriptions, and it had been a while. It had been like a window where I wasn't picking up my prescriptions, so they labeled me inactive on the list. So that caused me to be extremely depressed. Like, I honestly was about to give up. Like, I didn't care anymore. So I think 2014, this lady had contacted my mother and was like, she wanted to give me her kidney. It was a lady, I had never met her before in my life. She went to the doctor to get all of her workup done to see if she was a match, and surprisingly, she was a match. Ended up being a match, and we had set a date. I think maybe 1 or 2 days before I was supposed to go in for the actual transplant, the doctor called me and told me that we were going to have to cancel the surgery because my white blood cell count was too high, which meant my body was trying to fight off some kind of infection, meaning that if I was to have the kidney transplant, my body would try to fight the kidney off. So at that point, I was done. Like, I said I was done before, but at this point I was done. It had sent me into a horrible depression. I think I had slacked up on my treatments again. Like, I didn't care anymore. Like, it was just, I did not care at all. I really didn't care. Like, I just wanted this to be over. Like, at this point, I just wanted to die. Like, I didn't want to deal with this anymore. It was just, it was a lot. It was a whole lot to deal with. I really didn't want to talk about the entire story within one video because I want to be able to have more content. But I really hope that my story helps somebody that's going through the same thing and gives encouragement and a little bit of hope for someone who's going through this as well, because it's a lot to go through, especially being a black woman. And I know there's other black men and women out there who look for support and look for guidance from someone who's going through the same thing that they're going through. Dialysis isn't typically something that a lot of young people go through. Like, I think when I first started dialysis, it was three of us that were under the age of 25 at the time. Everybody else was maybe 40 plus, 50 plus, no offense, not old, but you know, older. And one thing I can say about kidney disease, it's a silent killer, and it's something that a lot of people aren't knowledgeable about, because a lot of people don't know how vital your kidneys are to your body and to your health. So I hope that this video and future videos can help somebody out there that's going through the same thing that I'm going through, or something similar. But make sure that you like, comment, and subscribe for more videos. And I hope that you guys have enjoyed and will continue watching my journey. Thank you. I didn't quite cover everything in this video, but if you feel like you have any questions about anything that I've said, or anything that you feel like I may have went through, or anything that you're going through that you may have a question about, please don't hesitate to ask, because this has been a crazy journey. I'm telling you, it's been a lot of stuff, a lot of situations that I've been in, a lot of things that have happened that I didn't even cover in this video that I really want to cover soon. But if you have any questions, please don't hesitate to ask. And if I can answer, then I will surely answer. And please don't forget to like, comment, and subscribe for more content. And see you on my next video. Bye.